And so, there's a lot of younger people who go right into an MHA or right into an MBA. And I understand, but the reality of it is that healthcare is a growing industry. Always will be. And you have so much growth opportunities. And you want to treasure that educational opportunity after you've had experience, because you're going to have so much more that you can bring into it. And then through that, so much more that you're going to take away from it. So that's one thing. The second is, don't be afraid to take on new aspects. When I was in my role, there was many times where I was like, I don't. And I remember with one of my senior vice presidents, I don't. And he looked at me and he said, listen up. You are given an opportunity because I know you can do it. Do it. It will be transformational for you. And I'm thinking, no way. But then it was. It was absolutely transformational.
To the Advancing Leadership Beyond the Bedside podcast. I'm your host, Mike Duggan, and if you're a leader in the healthcare industry, you'll love today's episode because we're talking with Geoffrey Roche. Geoffrey, a son of a nurse, is a healthcare expert, diversity advocate, and education enthusiast, presently serving as the inaugural North America Director of Workforce Development at Siemens. He often speaks on healthcare workforce topics at national conferences such as Becker's Annual and HIMSS, to name a few, and in 2022 was named to the Forbes Business Council for his national level work. With more than 9 years of experience in hospital administration, he has also held leadership positions at various universities and has served on various boards and committees, including the United Way of North Carolina, of Lebanon County, and of Pennsylvania, as well as serving on the Patient Safety Committee for WellSpan Good Sam Hospital. Geoffrey is also the co-host of the podcast Holistic Leadership, the Future of Work and Education in Healthcare. Today, we're going to hear a little about his career journey and how he has evolved into becoming one of the most sought-after thought leaders in workforce development. Perhaps we can get him to share some tips on how others can reach their career aspirations, along with advice he would give to other leaders in our healthcare systems. Geoffrey, welcome to the show, and thank you so much for taking time to join us today.
Absolutely. So good to be here with you.
Can you share a little bit with us about your journey in healthcare administration and how you came to focus on workforce development?
Yeah, absolutely. So I, obviously, as you said, I'm the son of a nurse. My mother had a huge influence in what first brought me into serving in a hospital. But it was actually in college when I was a senior, my academic advisor said to me, hey, you've done this. Let's do an internship at a local hospital. And so that was really what first kind of introduced me to thinking all the administrative opportunities that one could have. And so landed my first job, which initially was serving as the community relations coordinator for our healthcare system, which was then Pocono Health System. And in that work was, really leading all of our work in the community, our engagement with the business community, our engagement with the academic community, serving on various different boards and committees for our health system. Also served as the hospital spokesperson for all of my tenure. And then also moved into leadership when I was promoted by our president and CEO, who was a nurse CEO. She was the best leader I ever had. She really mentored me, coached me, empowered me to take on new challenges, one of which was to develop our government affairs program. So I developed that, which was of keen interest to me as well. We had great success results, got money, was able to be awarded money, funds for, linear accelerators and work in our cancer center to launching new healthcare facilities. Did a lot of work to bring economic development grants to our hospital system. And so a lot of that kind of started a lot of my work in also sort of the workforce development space when I was at the healthcare system. And then also did a lot of work with academic partners on programs and better ways of fine-tuning curriculum and different training opportunities. And so that was my first job and certainly was a wonderful experience. And then obviously we were acquired. And like in healthcare, oftentimes when you're acquired at a director level, there's restructuring. And so went through that experience. And then actually that's when I moved into academia. Because I had done a lot of work with academia, I thought, there's some great parallel translation of those skills, could go in and do similar work. And so I did that with 2 different academic institutions.
Wonderful. What a great personal experience of having a good mentor, and someone who's willing to develop you as far as your CNO there. I think that's wonderful. I know that you often speak, on healthcare, of course, workforce topics at national conferences. What are some of the most pressing issues that you see in healthcare workforce development today, that these health systems are struggling with or trying to address?
Well, obviously, as we all know, right, we've got a significant supply-demand gap. And, whether it's in nursing, whether it's in imaging, whether it's in lab, allied health, even in the administrative areas, we've got a significant supply-demand gap. I think we have to acknowledge there's a number of things that cause that. A, we need to get more people interested in serving in healthcare, from the middle school, high school age, all the way through college. We also have our challenges at the academic level because certain academic programs can't expand or grow because of accreditors. And so, there's a lot of work to do within that space as well. We also have significant bottlenecks with clinical placements at our hospitals. And so there's just a litany of different challenges that we're facing. But I think at the core, we also have to be honest about the fact that we've got a cultural challenge in healthcare too. We see significant amount of people leaving healthcare, leaving their organizations because of a bad or poor manager or the culture. And so, we've got to really internally look at how we address that organization by organization. And I would also add, with the issues of burnout and certainly the issues of dissatisfaction and such, which, even most recently, the nursing report, which came out, cited that, again, increasing numbers of nurses saying we're dissatisfied, we're burnt out. Leaders in healthcare need to also recognize that and do something about it. And I have been arguing for quite some time that, we've got to get the board of directors and the trustees, as well as the shareholders for the for-profit healthcare systems, to really understand that fiduciary responsibility is not just financial. Your duty and your responsibility as a board member, as a shareholder, is ultimately to the patients. And you can't have good quality, effective care if you also don't have the staff and if you don't have the clinical team. And so if you can't take care of them, you're not going to be taking care of your patients. And so, fiduciary really needs to mean everything from quality to risk to safety to workforce, et cetera, because ultimately it's our patients that we're there to serve, and we also need to serve our team.
Absolutely. I think it's really insightful that you talk about the culture and how people are leaving healthcare. It was somewhat of a problem before the pandemic. There was burnout to some degree. And, in my shoes here, working with hospital leadership to recruit and build better teams and with people to advance their careers, I really do spend my days speaking with physicians and nurses, leadership in particular. And I must say that since the pandemic, it really has almost been alarming at times, the number of people who I contact whose active plan is to retire within the next 6 months to a year, how they want to leave healthcare, how they're looking for or taking other positions outside of the industry. On top of almost a cultural kind of feeling I was getting from a lot of these younger nurses and physicians who seemed hesitant to take on leadership roles before that, right? So it's almost a compounding of, do they want to advance, and how are we supporting and mentoring that? And also, how do we keep them enrolled, right? And how do we get more people in from a young age to be engaged with this? Strong challenges that many of my clients are facing as well. But I think that, those that are working with colleges in particular and really developing relationships with schools are starting to improve their pipeline coming into at least the first level types of roles for nurses. Can you share a particularly, impactful project or initiative that you've led in, workforce development that you are proud of, or that you think has, garnered some results that others could emulate?
Yeah. In my hospital days, the one project that comes to mind is actually a pretty innovative one. I was working with one of our chief medical executives over our chronic and medicine service line at the time. And it actually was also, a born vision of our CEO. And I mentioned, our CEO earlier, who was my mentor. And she had just a keen, innate commitment to serve the community, which I think oftentimes a lot of leaders in healthcare say, but whether they practice it is another question. She really had that commitment. And, we were a very busy healthcare system at the time with 90,000 emergency department visits in what was, only a 239 inpatient bed hospital. And so, as you can imagine, that was a really significant challenge for the workforce, a significant challenge for the medical staff, and frankly, a significant challenge for all of us, including our patients. And so as we started to really look at, the super utilizers and the data and understand that data, what became clear is we needed to look at a better way of helping these super utilizers better manage their care and ultimately redirect that care into better settings. So there were a number of things that we did. We needed to add and advance urgent care centers in the community. That was definitely paramount. But we also knew that not all patients that were super utilizers would either be able to get to an urgent care, because of transportation. Even if we tried to have it on a public bus route, there were still challenges, or cost. And so we also knew we would have to think a little differently. And so we collectively came up with the idea of what we called our health coaches program. And when we first thought of it, the idea was like, well, we really want to engage students, because how do we build the next generation workforce if we don't really engage them? And so we worked with our local university, which was East Stroudsburg University. They had several healthcare programs. They had a nursing program. They had athletic training. They had exercise science. Had, several other programs. We also were a partner at the time with the Commonwealth Medical College, which was a local medical college that now actually Geisinger owns. Mm-hmm. And we had Wilkes University's pharmacy program, which in the Scranton-Wilkes-Barre area was well regarded. And so we said, well, what if we could bring together nursing students and exercise science students and medical students and pharmacy students to ultimately go to the homes of these patients? Think differently here. Send them into the homes of these patients. Talk with these patients when they're discharged. Are they following their discharge plans? What issues at home may be contributing to the readmission? And then we worked with our local payer, at the time Blue Cross, who actually funded telemedicine, so that while these teams were going out with the patients, the doctor, the nurse, the navigator was on the other end, because they couldn't always go to the home. And we were really, coordinating care. That project, which then actually became credits, so the students that were in it at East Stroudsburg University were earning credits as part of it. It was an actual course. And the best part of it is that the course was taught by our leadership, both clinical and non-clinical were teaching it. So our risk manager taught the risk management. Our corporate compliance taught the corporate. Our CEO taught in it. Our CNO taught in it. Our CMO taught in it. And the students loved it, because they were really getting practical time with all these leaders. And then they were going to the homes of patients. And what was transformative about it was not only was it great for the students, but it was also powerful for the patients. We significantly improved and actually reduced, I should say, the readmission of those superutilizer patients. We were also able to learn about some of the challenges that they were facing at home. We actually had a situation once with a patient in that program that we wondered why this patient was coming back all the time, back and back, back and forth, back and forth. Well, when the students went to the home, it was abundantly clear. Never had the patient shared with us, because they were afraid if they shared, they would be homeless. But they were living in a housing, an apartment complex that actually was full of mold. And so the students immediately reported that. Also, our social workers got on it right away, and we helped to get that patient a new home. And that patient didn't show up anymore to the ER, right? Because they got out of that atmosphere that was impacting their lungs and hurting their allergies and hurting their health. And, that was a perfect example where, all that time, we never knew. The patient didn't want to admit it because they were afraid to become homeless. But through students being able to talk with them, understand it, see it, we were able to help that patient not only get a new home, but improve their health. And so very, very transformative program that certainly had great ramifications from a workforce perspective, taught interdisciplinary care at the foundation, which I really loved about it. And it was just a blessing to be able to work on something like that.
Yeah, that sounds like a fantastic project. I love that you were able to get the engagement of the students, to have them in the actual patient's home, to see them, to have the empathy, to really understand what people are going through. I'm sure that felt great for the patients too, as far as giving them better access to quality healthcare, right? And hopefully more affordable healthcare. It kind of reminds me of, I don't know if you're familiar with PACE or the PACE programs, but it's kind of this idea of trying to deliver care to people where they're at, right? And surround them with the care they need. And I could see how that engagement would really be just so attractive to students, that your C-suite was actually active and engaged and teaching them practical real world knowledge that they got to use. It seems like a program that other hospitals could implement, right? In a way to funnel people in. I would imagine that the actual rate of people going into or working for that facility for a certain period of time after schooling, did you see an increase or track that at all as far as the number of people going into that?
Yeah, there was definitely a significant increase of the students that were going into the health coaches program as an addition, right? Because, many of these students were already in nursing, were already in exercise science. But what they weren't necessarily in before was this program. And so this program gave them another opportunity. And frankly, what it did also was help them really discover if they really wanted to do something versus another, right? And so it was an additional way to get actual on-the-job credit for learning. And so significant improvement in growth from that standpoint.
Oh, that's wonderful. So we started engaging them a little bit younger. we're able to get them into, the health system in whatever capacity they're interested in. Now they've worked for a couple of years, they're thinking about their future. What advice would you have for, an aspiring healthcare leader looking to advance their career, into healthcare administration?
First of all, I would definitely always encourage an aspiring healthcare professional to say, get into a job first. Don't go and run and get that master's degree. I will absolutely say, after you've had a couple years of experience, getting a graduate degree certainly is very important. But have your health system pay for it. That's what I did. It was of great benefit to me. And what I learned was when I was in that course and when I was in that program, there was so much more that I could contribute. And there was so much more that I was able to learn because I had that work experience. And so, there's a lot of younger people who go right into an MHA or right into an MBA. And I understand, but the reality of it is that healthcare is a growing industry, always will be. And you have so much growth opportunities, and you want to treasure that educational opportunity after you've had experience, because you're gonna have so much more that you can bring into it, and then through that, so much more that you're going to take away from it. So that's one thing. The second is, don't be afraid to take on new aspects. When I was in my role, there was many times where I was like, I don't want to do that. And I remember with one of my senior vice presidents, I don't want to do that. And he looked at me and he said, listen up. You are given an opportunity because I know you can do it. Do it. It will be transformational for you. And I'm thinking, no way. But then it was. It was absolutely transformational. And I think for younger professionals, you really have to look at it from the vantage point of healthcare is such a living laboratory. It's like a town and a community in and of itself. There's so much. You've got food, you've got you've got house, you've got everything. And if you have great leaders and you have the opportunity for mentorship, it really becomes the best role and experience you could ever have. But you have to be willing to take on new initiatives, new projects. You have to be adaptable because we know it's an ever-changing industry. You certainly have to be committed to service, both internally and externally. And I would also say you have to be curious. Always be curious. Have that curiosity, because one of the things that always was interesting to me was what I learned later was that same senior vice president was always challenging me to gain operational experience, because I wasn't in an operational type of role. And I'll give you a direct example where I thought this was crazy. But, I led the strategy with a team to ultimately acquire an ambulance company. It was very important for us. We wanted to build out our pre-hospital service line. Our competitor was already doing it. We needed to. I had the relationship with the board. I knew them. I grew up in that community. They were the same ambulance company that was always at my school. They were basically my friends' parents. And so I did a lot of the work with a great team. And so when the acquisition happened, the leadership, including our CEO, said, you're leading that service line. And I thought, I'm leading the service line. I'm not clinical.
Yeah.
And I've never ran an ambulance company, but I'm leading the service line. And I'll never forget my senior vice president. He goes, this is an awesome opportunity for you to shine. And so you're doing it. He said, you hire who you want as the clinical leader. They're going to manage all the clinical aspects. Your job is to administer the support around the budget, administer the culture, administer all aspects of connecting them into the healthcare system. And guess what? You get to lead the integration. And when I look back, it was the most awesome experience that I could have ever had. Because not only did I get to experience and understand that pre-hospital to acute side, but I also saw the dynamics of the different people, the EMTs and paramedics, and what it was like for them to go from being an ambulance company to a health system employee. And then what was it like for them to realize that they were now part of the same team when they brought a patient into the ER. Very transformational things. And so certainly a great experience, but wouldn't have done that, again, if I wouldn't have been encouraged and mentored to remain curious.
Yeah, I love that. Encouragement is so important for all of us to, stretch ourselves out of our comfort zones. Oftentimes we look back and realize that wasn't so tough, right? But that fear really does hold people back. I meet, wonderful leaders every day when recruiting, who you can tell are just really hesitant about taking that next step. Am I worthy Do I have the skills? Can I be successful? Wow, that's really a lot more people than I currently manage. And we need some of that bravery, but so much of that comes from having a strong mentor and strong encouragement. The people that I see take positions. I just helped a gentleman take his first medical director role. And it was one of these instances where I think he was on the fence, but his mentor, who's also his boss out of, a residency, really encouraged him. And without that encouragement, I don't know if he would have taken that leap. So it really is so important for us to be thinking about our future leaders who will eventually be taking care of us one day, right? Or the teams that they lead will be taking care of us, and really trying to, find people, identify them, and then work with them to help them move forward. So in the interest of time, I would like to really just thank you for sharing some of your time with us today. I know that you have a significant amount of content and ideas and different ways that you may be able to help people transform their workforce. Think about development, think about some of these areas and how we're going to address the challenges. So, where can people connect with you to learn more about, all the amazing work that you're doing?
Best place certainly is on LinkedIn. Happy to connect there. They'll certainly see more about not only the work that I do, but also all the different activities and certainly projects that I'm engaged in. Happy to connect there.
Wonderful. Well, I'll be sure to include a link to your LinkedIn profile once we get this podcast up and live. But otherwise, thank you so much for spending some time with us today. I really appreciate your time and your thoughts, and it's been a pleasure.
Absolutely. Thank you so much.